for those of you who are joining us that maybe are part of Dr. Rade's practice and don't know us, we will post this interview live tomorrow on YouTube. So if you're watching this on YouTube, definitely subscribe to us and you can look at some of the previous episodes. We'll start off with basically telling the folks here what Hum Day Conversation is. I was telling Dr. Rade, we started in January with no goal other than to unite people in a pandemic where, access to doctors and chiropractors and massage therapists and naturopaths was starting to be somewhat limited and hard. And knowing that, patients' problems didn't go away because there was a pandemic and many people had questions that went unanswered, we kind of wanted to reunite the community and, stand out a little bit and start using technology that, we could leverage to get people together. So we started with the concept that we were going to meet once a week. It evolved into what we call Hump Day Conversation. And every week, Ben and I come up with a topic. So we've talked about Parkinson's, we've talked about, bursitis and frozen shoulders. And we dive into these conversations and it's been well received and people are chiming in. We've had, 1,200, 1,500 views on our Facebook lives, which is fantastic. So I always say, look, if somebody's in British Columbia or New Zealand and they're chiming in and they're getting answers, well, that's something that we could not do if we were still within our four walls. So thank God for this technology. And, if these times have taught us anything is, to pivot and, do something that you might not do if it was just normal times. So tonight, as we do once a month, we have an invited guest. And Dr. Rade, I got to say, I was on your website, and unless you've transcended sleep, I cannot do the math on how you've accomplished everything you've accomplished. And unless, I don't know, but I was really amazed, and I'm humbled to be able to be here with you. And I've had many, co-patients that we've managed together. And I've always had an intrigue in terms of what you do. And I tend to align my practice and make, people available to my patients that I feel resonate with, with the highest value that I have, which is education and learning, and make sure that we were at the tip top of the technology and being innovative. And if I had a checklist, I'd be doing check on what you do. So I really, really appreciate your time that you're taking outside from your family. And I understand it's 9 o'clock. And I just want to say that just shows what kind of person you are and being able to disseminate this information. So without further ado, Dr. Brian Rade, thank you so much.
My pleasure. And thanks for all the kind words, Dr. Roach. That's very nice of you.
So just to warm up the conversation tonight, Brian, maybe you can tell us how you became a naturopath, just so we can have an idea on what's your why and what we're just talking about the why in your name that's not supposed to be there. But speaking of the why, what has been your biggest motivation being a naturopath, and how did that come about?
Yeah, it came about, actually, quite frankly, it's similar across the board with a lot of naturopathic doctors. A lot of us had health issues in our younger years. Some folks, it was health issues with a close family member or something like that. For me, I had some chronic health issues, couldn't find any solutions through more conventional means. I actually found a fantastic chiropractor that was helping me a lot with the back pain that I was having at the time, back when I lived in Ontario, where I hail from. And he actually, kind of got me interested. Like, he told me about naturopathic medicine. I never heard of it before talking to him, and did a lot of reading, a lot of, my mom, who's wonderful. Since I was probably 12 or 13, she was very into complementary healthcare. Used to take me to Toronto to these health fairs that she dragged me kicking and screaming, but eventually I liked going. And I just kind of came into it organically that way. And sort of like the why, or the driving force for me, is that when I first started practicing, I had a fairly general practice, seeing a lot of IBS and, menstrual issues and insomnia and headaches and like fairly, just more generic type stuff, if you will. Those are all significant conditions, but like they were fairly like typical things that naturopathic doctors would see. But over time, I had just patients here or there. It's like, oh, like they're not responding to the therapies that usually work, and so like, what's going on? So I I figured the solution's out there. I just need to hit the books more. I need to go to more conferences. I need to do more courses. And so as I learned more, then I realized, oh, now that I know this and this, I can help that patient that I couldn't help before. And then that ultimately just kind of snowballed into me, getting a reputation where I just am known in some circles anyways to be the guy to refer to if there's a really tricky, complicated case. And so now most of my patients, granted about 25% of my practice is orthopedic, hence us talking about injection therapies today, but the other 75% is mostly more challenging, complicated cases like a lot of fibromyalgia, chronic fatigue syndrome, autoimmune conditions, patients dealing with a cancer diagnosis, a lot of neurodegenerative conditions like MS and Parkinson's and Alzheimer's and whatnot. So it's pretty much just a lot of referrals now, from folks who are just struggling with their patients, or just word of mouth, like, oh, I've got this serious health issue, I better go talk to that guy. So that's so it's kind of just stemmed from like wanting to be able to help people, of course, like we all do in the healthcare
Mhm.
profession, but really driven to help the folks that otherwise have seen many other practitioners and aren't able to get the results they're looking for. So that's kind of what drives me to keep doing all the extra courses and everything that you were alluding to.
Yes, that's it's funny because sometimes you get people that come into us and they're like, you're my last hope. I'm sure you've never heard that before, right?
Never, never.
So there's somewhat of a pressure, and it's humbling to be able to do that. So, to have a practice that's driven by those types of patients, I guarantee you, and I can talk to the people on live on this webinar, it's taxing at times, right? And you
Mm,
sometimes fall prey to not taking care of your own health because, if you're in the profession for the right reason, you give and give, and sometimes you're the one that falls apart, right? So I appreciate you for everything that you do, and I understand what it takes to run that type of a practice, and it's humbling. You're pressured, and you want to deliver on your promise when you're telling these people you're going to be able to help them. So let's lead into what we're going to be talking tonight. So we've done many hump day conversations, Ben, on problems that we're probably going to reintroduce tonight with a different outlook in terms of what Dr. Brian Ray is going to be able to provide to us. But we've talked about arthritic knees. We've talked about bursitis in the hip. We've talked about degenerative conditions. We've talked about facet joint issues and shoulders, and regardless of how those came about, uh, people will go down, the general road of, going to their medical doctor, right? And the medical doctor's path is typically, here's an anti-inflammatory. Let's see how it goes. And the see how it goes is in reference to the pain. And if the pain goes away in the medical model, we assume that, all right, the problem's gone. There's no pain, right? So now the destruction of the joint and generation, whatever's there, the dysfunction is still there. So the pain comes around. You go back to your medical doctor and he says, well, maybe it's time for you to go see a physio. So now they're kind of juggling practitioners. And at one point, they end up, seeing somebody like you. So the topic tonight is injection therapies. Can we start with PRP, Brian?
sure.
Yeah. So I've referred patients to do PRP to other practitioners, and in some cases the result has been phenomenally like amazing, right? So let's start with what is PRP and how you apply it in your clinic for certain conditions.
Sure. So PRP stands for platelet-rich plasma, and so essentially, breaking that down, it means that we're injecting elements of a patient's blood back into the body parts that are having degenerative issues or pain issues, and it's the of all the blood that we remove from the patient in preparation to do the injections, we're injecting all the platelets back plus the plasma, so the liquid part of the blood, and then that's it. So we're getting rid of all the red blood cells, all the white blood cells, most of the plasma, and then we're just injecting all the platelets plus some plasma. So that's why it's called platelet-rich plasma. It's just kind of super concentrated platelets, essentially. So essentially, we draw the blood, and it's not a ton. We're not like removing a liter of blood or something like that. It's
Yeah, yeah, yeah.
depending on the system that's used, it's anywhere from 10 to maybe 30 milliliters at most, or
Yeah.
like, 3 to 5 standard blood draw tubes, depending on the size of the tube. So not a ton of blood. Then that blood is spun down in a centrifuge, and the centrifugal force basically just separates out all the blood components, so that you wind up with all the platelets essentially at the bottom of the plasma. And so that's what we extract. And then that's mixed with a local anesthetic. We use procaine, which is the same kind of numbing agent a dentist would use to freeze your mouth. It's just, it's a more mild acting one. So you don't feel like you've got to give a big golf ball in your knee, like you feel like you have a golf ball in your mouth when you get your mouth frozen. And so that's mixed together. The procaine just makes the process more comfortable for the patient. And then that's essentially what's being administered to the joint or the ligament or the tendon or the muscle or whatever it is that's damaged or having an issue with kind of structural integrity. The whole reason we would do that, it's like, why the heck would you stick platelets there? Because if anyone's ever thought about platelets since, high school biology class, like, well, it clots your blood, which is true, it does that. But when there's an injury and platelets go to the site of injury, yes, they initiate the clotting cascade, but they also release growth factors when they see damaged tissue. And those growth
Yeah.
factors say, oh, hey, like there's a cut on your arm. You need to heal up the damaged muscle and fat cells and skin and etc. So in a similar way, when the platelets are introduced into that, cranky joint or that damaged tendon or whatnot, then they see, oh my gosh, there's a problem here, and then they release those growth factors and help to promote tissue healing. So that's why we inject platelets into the area.
So in that plasma that will basically be at the top, right? Once you
Mhm,
centrifuge,
mhm.
how many stem cells would be in there? Like I think there are stem cells within that plasma to a certain level, right?
Um, Maybe. To my understanding, most of the companies that create PRP prep kits, and there are many of them, there's a lot of
Yeah.
competition, and they're all like generally pretty respectful of each other, but generally it's like everybody's got the best one. So
Yeah. Yeah.
it's like that in a lot of industries, unfortunately, or better or for worse. But they generally just talk about the platelet concentration. I really haven't seen them boasting about stem cell concentration. I mean, when it comes to stem cell injections, like where samples are derived from bone marrow or fat cells, and then those
Yeah.
are spun down and processed, like they talk about the stem cell concentration, but I don't know what kind of, to what extent there's any stem cells in PRP per se. I'm not sure.
Okay.
So,
Yep.
so we talked about how, you would use PRP for different types of tissues. We mentioned ligaments, the muscles, and even the cartilage, joints. Are there certain tissues that PRP is, you know, better used for? Is that's the right question? Is there a certain tissue that will respond with a greater result than a different tissue, for example?
I don't, I wouldn't say that there's a more responsive tissue type in my experience. I would say that tissue that has been degenerated to a greater degree is going to be less, and really well, I would say that in my experience, everything responds about equally well, except that if you have a really degenerated joint, like bone on bone arthritis, for example, like those are the cases where, I just have the conversation with the patient up front saying, I've had some cases of say bone on bone hips or knees or
Yeah.
shoulders or whatnot, and like there's a beautiful amazing response and the patient's virtually pain free, everything is great. And so I have seen that in practice. But I've also had a number of cases where all that we see is maybe some modest improvement and it's very temporary. So like in that case I would say that's a treatment failure. Like we get a little bit of improvement here and there, it's not
Yeah.
lasting. And so those are the cases where if there's a lot of degeneration, it's going to be trickier. That being said, it's really interesting. Like a lot of the conferences that I go to or I've had the chance to speak at, other presenters have talked about the importance of having, good, healthy mitochondrial function. So your cells are able to make enough energy to actually do the healing work. Because as I'm fond of saying to my patients, I have the easy job. Like I just get to, stick the needle in the right spot and put the growth factors there, and then your body does all the work. But their body can only do the work if it has the energy and resources to do the work. So if they're, eating a poor diet, and they're sedentary and they're smoking, and most of my patients are pretty healthy, so I don't really run into a lot of that. But
Yeah.
if they were, like, that's not going to work as well. So there are definitely things patients can do to make their injections work better.
Dr. Rade, at what point do you use imaging when you're doing those injections? Do you use fluoroscopy? Do you do any imaging while you're injecting for certain joints?
So I do have a ultrasound machine, so I can do
Yep.
ultrasound guided injections, and that is an option for patients. It, the for certain injections, like if I'm injecting like over ribs, or if I'm doing, say, like facet joints in the thoracic spine, or there's a technique I use called hydrodissection, where we're injecting not PRP as a rule, but like other things, like kind of
Yep.
just right adjacent to nerves and whatnot. If it's over the like over the torso, i.e., when there's lungs underfoot, then like that's just a hard line in the sand for me. I'll only do that under ultrasound guidance because it's
Right.
just that's just the only safe way to do it. For other, and then if I'm doing, say, hydrodissection, where I need to be like the needle tip has to be right beside the nerve, then I'm absolutely going to use an ultrasound because you just can't do that without imaging. For something like a knee joint, where I've injected thousands of knee joints, I could just do it with my eyes closed. Same thing with hip joints, shoulder joints, etc. So
Yeah.
if it's if patients sort of know that I do ultrasound guided injections and they request it, or if they bring it up, then I'll absolutely do it. But just to be perfectly frank, it adds more time to the procedure, and in my opinion,
Sure.
doesn't bring any benefit to the patient for
Yep.
certain injections. So it's not a across the board thing I do. Don't get me wrong, like it's super cool, and like I always feel like just super slick when I'm using my ultrasound machine.
Yeah.
And the
Yeah.
thing costs enough that I like to use it, but it's just really about, if it's not going to affect outcomes and it's going to cost more for the patient, then I, don't use it for all injections across the board by any stretch.
It's a funny story. I heard about PRP. A good friend of mine treats tons of professional athletes, and he was treating a Canadian sprinter at the Olympics. And this particular sprinter had torn his quadricep muscle about 3 weeks before the Olympics. And there was a German doctor there that said, "Oh, we're going to do an injection." And so anyway, that was PRP at the time, wasn't known. Anyway, so this person, this printer, got PRP, ran 3 weeks later, which what was diagnosed as a torn quadricep, ended up winning the gold medal. Right. So that was pretty cool. So he was always telling me about PRP. And I think in the US, what they do is they'll do PRP, but they'll augment it with stem cells. So they'll mix in the stem cells with it.
Mhm.
So, obviously we can't do that in Canada for whatever reason, right? The stem cell issue has been battled for a while, but yeah.
Mhm. Yeah, yeah. I mean, my colleagues down there, like I've taught, I do something else called ozone therapy, and which is another injection therapy, and I've taught, and like I teach a annual ozone therapy certification course for other clinicians, and I've taught
Yeah.
down in the States, and so down there, and they're talking about like stem cells and these things called exosomes and something called biological allografts and various things, and they're all like super cool. They're all ridiculously expensive,
Yeah.
but talking about all these things, and when I talking to my colleagues, they're saying like, so like if you have a patient and like say they're only able to do PRP, like how does that work? And they're like, well, it usually works just great, but like all the other stuff is just so cool, and they come in asking about it. And like hearing those stories from the trenches, it's kind of like I understand like they're stronger, but like I never feel like I have hands tied behind my back, not being able to offer those other therapies,
Yeah. Yeah.
except maybe in those like really extreme, like the bone on bone arthritis is just not really responding as well as we'd like it to PRP. I'm like, I kind of wish I could get my hands on some exosomes or some
Yeah.
biological allograft. But yeah, it's just not an option here, for better or for worse.
So my experience is like typically with joints, you'll do 1 to maybe 2 to 3 injections max, Brian.
It really depends on how the patient's body is responding. So if
Yeah.
a patient, like with PRP, or prolotherapy, which is sort of the parent therapy of PRP, very similar in many ways, just not as strong as a rule, although it can work very well for people, just not as quickly and as PRP as a rule. Um, with with those cases, they're typically done with a maximum frequency of once a month because, again, I'm injecting the substance and then the patient's body is doing all the work. And
Yeah.
so if a patient came in, say at the 1 month mark, and they're like, yeah, things are starting to get better, do another treatment, come in a month later, yeah, things are definitely doing better still, but still not 100%. Do another injection a month later. So now we're doing the third one. They come back in a month later, and if they say everything's just hunky dory, then like, yeah, we're done. Give me a shout if you need a booster treatment at some point, or if you do
Yeah.
something silly and tweak your body part again. Um, Whereas if after that third treatment, they're like, yeah, I'm like 75% better, we're seeing stepwise improvement, I'll absolutely do a fourth treatment or a fifth treatment. One of the challenges I think that exists, because there's not a shall we say, a wide adoption of PRP in conventional medical
Yeah.
orthopedics. And I think the reason is that there, to my knowledge, there are at least some orthopedic doctors out there who do PRP, but they have like a one and done policy. Like, I will inject you once and then let's see how it goes. And like, that's it. And the question mark is like, why would you do that? And I think the reason is that when you look at all the studies that have been done on PRP, all the studies that have been done on prolotherapy, with very rare exception, they only do one treatment and that's it. Like, it's one session and then they assess and that's it. And I would say, like, somewhat miraculously, they do see like pretty impressive results in a lot of those
Yeah. Yeah.
studies, even though in practice it's like it's relatively rare that you just need one treatment, unless it's someone who's very young, on the younger end of the spectrum, like very vital,
Yeah.
and it's just like a mild to moderate injury. Then yeah, I've had lots of like one and dones, but for something more degenerative, it's like it's relatively rare that it's just a one shot wonder sort of thing.
So for PRP, what are people, I know, because the question will be, what does it cost to have an injection for PRP?
Yeah, so it depends on what PRP prep kit is being used. So
Yeah.
another little interesting tidbit, kind of like a behind the scenes tidbit, I guess, is another question I like to ask my colleagues who do PRP is like, hey, like, what kits do you use? Have you used different types and this and that? And because as I mentioned earlier, there's quite a wide range of many different companies out there, and are there's quite a wide range of pricing tiers. And generally speaking, the feedback I get from my colleagues is that it doesn't really seem to matter. So whether you have like the cream of the crop, like we concentrate your platelets like tenfold like above baseline amounts, versus like
Yeah.
we only concentrate them like 1.3 times above baseline amounts. From anecdotal, what I've heard anecdotally, it seems to not really make a big difference, which suggests to me that, again, like, the body just needs that little push in the right direction, and whether it's a little push or a big push, it can work well.
Right.
In my own clinical practice, I've used a few different types of kits, and what I've generally found is that they all seem to work just about as well. And so I just basically use the least expensive kit, and it seems to work just as well as the ones that cost twice as much. So again, the price ranges, but generally speaking, for PRP, at least at my clinic, the cost of it is for my time and my resident's time, because my resident's the lucky duck that gets to do all the blood draws, because I get to delegate that, which I like doing blood draws. I just don't have time to do them.
Yeah.
So, for her time, drawing the blood and prepping it, my time to actually do the injections. And if we're just doing, one or two spots, we might be able to do that in 20 minutes. If we're doing like 6 or 8 spots, it might take 45 minutes, depending on what needs to be done. And are they neck injections versus a really simple knee injection? Like, it depends. And so we basically charge for our time, which generally speaking is around like $130 or so, give or take. And then the cost of the actual PRP kit itself is $175. So it's about like 300 bucks and change, give or take, for a treatment.
Wow.
But then some kits are like 350 bucks a piece, or some are $500 a piece. So like, again, it just really depends on what kit's being used, and then of course the fees. I mean, the fees in, say, downtown Toronto or in downtown Vancouver, my colleagues out there charge quite a bit more. And in all fairness, rent is quite a bit more in those
Yeah. Yeah.
places. Not that Halifax is giving it away, the HRM is giving it away by any stretch, but yeah, so that there's quite a range,
That's
but that's what we charge, at least.
that's very good, Brian, because I know a colleague of mine, an orthopedic surgeon that does them, and they're going to be charging $800-900 an injection, right?
Yeah.
So
Yeah.
kudos to you to do that. And for everybody that's out there listening right now, that is a phenomenal price for PRP, and having it done by somebody who knows what they're doing.
Oh, and especially considering what the possibility is, right? And Brian's giving you the research here, and he's telling you what the result is, and he's basing this price off of what he thinks is best for you. I mean, this is it. It's great. The risk reward is phenomenal.
Because I had a PRP injection done on my thumb, because I was treating so many people, and to the point where I couldn't put any pressure at all.
Mm-hmm.
So I thought, this is my profession, this is my career. So I had an injection now 3 years ago, I've never had pain in my thumb before. So that's how it can be amazing. Like you said, it just needs a little push and the body kind of takes over. So that was a great intro talk about PRP. Guys, we're just going to take a break. If you're enjoying this lecture here for now, just give us a thumbs up and, a few hearts. This is from the horse's mouth, and it's a pretty good horse right now. Dr. Brian Ray's been doing this for a long time, and we really wholeheartedly appreciate your information tonight. Lots of thumbs going up. Awesome.
I would also use this opportunity to share the conversation
yes,
as
right
well.
now. Let's do that right now. Everybody that's on this talk right now, webinar, make sure you share this episode right now. Are PRP injections appropriate for rheumatoid arthritis, Brian?
So yes is the short answer. If we want to introduce something to help improve the strength and integrity of a joint that suffered some joint damage, with rheumatoid arthritis, we have to be pretty cautious, because where with PRP, PRP and prolotherapy both have in a bit of a reputation, not universally, but people who think about or know about these things, they have a little bit of a reputation for inducing pain or discomfort after the treatment. So sometimes their reputation is like, oh, it hurts a lot to get Prolo or PRP, and then the area is going to be sore afterwards. And granted, it is sore afterwards sometimes. It just depends on the method that's used. The old school method that, as I'll refer to it, is pretty aggressive, and it is very painful to have it done. What I would call more like new wave or new generation PRP or prolotherapy, which is what I do, or like as I like to call it, the PRP that doesn't make my patients hate me because it hurts so much. It's much more gentle, much better tolerated. However, whether we're using the more aggressive method, whether we're using the more gentle method, PRP by its nature, where it's inducing this healing reaction, it's going to induce some acute inflammation. And most of the time when people hear like, oh, inflammation in my joint or my tissue, like that sounds bad, that's what I'm trying to get rid of. It's like, well, chronic inflammation, which is painful and degenerative, is quite a bit different than acute inflammation, which stimulates healing. However, when there's an autoimmune condition like rheumatoid arthritis and there's already inflammation in the joint, if it's well controlled RA, then it's probably not going to be a problem at all. But if it's like kind of labile, or just if there is pain in the joint, like of a more inflammatory nature, then we have to be really cautious with working with the PRP, probably starting with a really low dose, building it up. And quite frankly, in a case like that, I'd be having a conversation with the patient saying that we should really be doing like the diet stuff and looking at immunomodulators and different things to like settle things down, like, and that will oftentimes make a big difference with the pain levels. And it's, to make a long story short, it's relatively rare that I find myself needing to do PRP with someone with RA, because the systemic stuff generally works quite well.
Funny, when I did the PRP in my thumb, I was driving home, and when you watch a cartoon and they hit their hand and you see the the red, I was like, holy Jesus, this hurts. And I was driving and I was like, how is this good for me? And then the next morning, I don't know, I got up, I was pushing myself off. I was like, whoa, that's weird. I didn't get any pain, right? So the next day was like, I called him back. I was like, this stuff is amazing. But I was cursing you coming out of your office because it was just brutally painful. And the numbing agent, like when you went in with the to numb it, was, I don't know what was better, being hurt by the needle going in to numb you, or being hurt by the PRP. I was like, if I think if I was going to do it again, so just inject once, right? And but anyway, that was my experience. But it was fantastic because it's worked miracles. Little segue. Can we poo-poo a little bit on cortisone shots right now, Dr. A? Because so many patients come in and say, oh, I got cortisone shot. Just anecdotal patient right now, a little bit of the story. I had a patient that, she had like 4 cortisone injections in her shoulder. One day she goes outside, it was windy, the door pulls her and she shatters her shoulder, right? Because, what a lot of people don't know is cortisone leaches calcium, from the bone, and you can get like regionalized osteoporosis in the area of the cortisone shot. And, in terms of a long-term approach, there is no like regeneration of anything with cortisone. It's basically an injectable anti-inflammatory, which, as you've mentioned, inflammation is good short term in order to bring blood flow to the area. But what are your thoughts, Brian?
Yeah, my my
You don't have
thoughts.
to be nice, right?
Oh no, oh no. I have to go against my nature here. I've been nice for years. I don't know if I can stop now. Um, so what I think, like the way I think, because I know we've talked about PRP so far, I've kind of touched slightly on Prolo, but like I have so many injections in my wheelhouse, not like 100, but like there's about half a dozen injection therapies that I use on a regular basis. And when I'm assessing a patient, I'm thinking to myself, well, what does this person's body need? Like, what is the mechanism of action that I want to tap into here? And so I can't do cortisone shots because we can't use prescription medications here in Nova Scotia as naturopathic doctors. But when I'm thinking about the mechanisms of action, thinking, well, cortisone, as you said, is like it's an anti-inflammatory and it's a strong one. And sometimes we want that anti-inflammatory effect. Sometimes it's very helpful. Now, there's other injection therapies like ozone therapy, which in my experience are also very good anti-inflammatories. And I've seen like hugely swollen joints, usually knee joints, like, reduced by half the size, like by the next day in some cases with just doing an ozone shot. But with cortisone, I think that, cortisone has its place, but I agree with you. Like, in my experience, patients don't really always know or understand the full extent to which the cortisone is not really the best for the underlying tissue. Like it will make the tissue a bit weaker. Maybe it's just one cortisone shot, or it's like one every like few years or something. Like maybe not that big of a deal. But yeah, by and large, like it really should just be a get out of jail free card, maybe to get out of pain.
Yeah,
But then as soon as you're out of jail, like start working like the Dickens to try to heal up that tissue because you don't want to have to get another one.
right. Yeah, no, that's I don't know. I just feel like it's yeah, it's a get out of jail, right? It's this is okay. I'm going to do this once. I'm going to feel better, but then get your life in order to figure out what's wrong, get the
Hmm.
proper diagnosis. Do something so that you avoid at all costs having another one.
Yeah, well, I mean,
Uh,
it comes back to that same idea of, looking at the pain and chasing the pain, right? And to the patient, if the pain is gone, everything is great, right? So this moment is
yeah.
great. So we have to, and that's why we do what we do is we want to get people out of pain for a long time, not just short
Hmm.
term fix.
So, Flood Your Body with Oxygen by Ed McCabe, probably one of the best books I've read on ozone therapy.
Hmm.
Let's segue into ozone therapy, Brian. How do you incorporate that in your practice? What is it, and how do we incorporate that in some of the things that people have in terms of arthritic pain, whatever they're having? What are the conditions that it's helped by? When do you do it? What is it? Let's go.
Okay, I'll try to channel Ed McCabe over here. One of my very very dear patients who passed away some years ago, she gave me one of his books, so it makes me very happy to think about that Ed McCabe book. I haven't thought about it in a long time. So with ozone, so ozone is O3. Everyone knows what oxygen is, of course, and so oxygen gas or molecular oxygen is O2, two little oxygen atoms bound together. But ozone is O3. So if I had the third hand, it'd be really handy right now, but it's basically three oxygen atoms bound together. And ozone, so it's a gas. It doesn't exist in very many places naturally. It exists up in the ozone layer, which we haven't really taken very good care of as a species, apparently, because there's like a hole in it. But of course, that protects us from UV rays. And then ozone also occurs closer to the ground when there's a lightning strike, because when the electricity rips through the atmosphere, it blasts apart those little oxygen molecules that make up, of course, a lot of the air we breathe into singlet oxygen atoms. And then some of them will recombine to form ozone. And so I don't advise being close to lightning strikes because it's not really good for your health. But if you happen to be close to one, what's that smell in the air? It's like, that's ozone. So I was going to say, I don't know who got the idea of, using ozone medicinally, but actually, interestingly enough, the person who developed the first commercially available ozone generator was Nikola Tesla, who like fancy electric cars are named after, but he also developed the alternating current, which we all use every day, like right now, and a whole bunch of other amazing technology. But he developed the first commercial ozone generator, I think it was in like the very late 1800s. And they actually used to use ozone like in World War I to treat gangrene, because we didn't have antibiotics back then. They actually published articles in the Lancet, like the prestigious medical journal, about ozone therapy back in the early 1900s. None since then, but they did used to publish about it anyways. So with ozone, when we can create this gas in a clinical setting, where basically we have an oxygen tank with 100% pure medical grade oxygen in it, and then it goes through some tubing into the ozone generator itself, which has an electrical current running through it, so like little lightning strikes, if you will. And then it basically, the electricity blasts apart the oxygen molecules into singlet oxygen atoms, and then coming out the other end of the machine, about 98% of all those oxygen atoms recombine to form oxygen gas, like just molecular oxygen, but about 2% forms ozone. And so we have this mix of oxygen and ozone. And all the studies that they've done, like the human clinical trials and animal trials they've done on ozone, it's always using that 98% oxygen, 2% ozone mix. But we just call it ozone because it's easier to talk about it instead of saying oxygen ozone mix. So essentially, why the heck would we want to inject ozone into someone? The reason being is because from a ton of human clinical trials, it's been shown to have anti-pain effects. It helps to improve function as well after injecting it into various body parts. And then we know from some of the animal studies and from some human studies, actually, it has a significant impact on modulating our immune system to ultimately reduce inflammation and promote tissue healing. So the way that I use it in practice is every time I inject either a PRP or prolotherapy, with my patient's permission, of course, I always follow it up with some ozone. And the way that works is, say if we went back in time, Clayton, and you came to my office and I was injecting PRP into you, so I would insert the needle into your hand, inject the procaine and the PRP, and then instead of then taking the needle out, then I would basically use my hemostats to pinch the hub of the needle, take the syringe off, so just leaving the needle in your hand, have my second syringe that has ozone in it that was just recently generated, attach it to the same needle, and then infuse the ozone into the exact same spot. So it's basically a combination of PRP and ozone going into the same spot. And so it's
That's
just
so cool.
it is so cool. And it's good for your manual dexterity skills as well. So, you have to be a little savvy to be able to do that. So it's fun. So as I like to say to patients, like, I'm poking you once, but there's two different substances going in. So there's no extra pokes, and ozone, once you have an ozone generator, an oxygen tank is not very expensive to fill up. So you basically make ozone for free, essentially, when you have a generator. So as I like to say, I'm not going to poke you more and it's not going to cost you more. So everybody, and it's going to help this to work better, because the studies that we have looking at PRP by itself versus PRP plus ozone, or prolotherapy by itself versus prolotherapy plus ozone, there's been a couple of studies done comparing those, and the combination works better than just the PRP or the Prolo by itself. So I say, this is going to work better, doesn't cost you more, there's no extra pokes. So everybody says, okay, sign me up. And so I always combine it. There are cases where I just want that anti-inflammatory effect for one reason or another. Like, say, when there's like a hugely swollen knee, I'm like, I don't want to stick PRP in there right now because I don't want to make that swelling temporarily worse. So I'll just do ozone with some procaine ahead of time to numb up the joint. So sometimes ozone is used by itself. And to be perfectly frank, for years I used ozone therapy, like prior to learning prolotherapy and PRP. Like, I used it for a couple of years, and I really resisted actually learning Prolo or PRP because it's like the ozone just works really well. But then when I'd run into the case of, like, moderately to severely degenerated joints, or a rotator cuff tendon partial tears and things, it's
Yeah,
like,
yeah.
like, it helps, but like it's just not really rebuilding tissue. Like, okay, I've got to bite the bullet and go do these training courses. But ozone on its own, like, just a phenomenally helpful thing, even just on its own.
So what are the different ways of injecting ozone though, Brian? Because you're not obviously always injecting in a joint, right? So let's say somebody has a concussion,
Mhm,
because I've heard it used for concussion in order, to clear like brain fog and stuff like that.
mhm.
So at that point, like, how do you introduce it to the body?
So if the concussion ultimately involved like some type of like a whiplash or like neck injury, then we might inject into those tissues, like whether to
Okay.
the facet joints or into the, some of the tendons or things like that. But the other way that ozone, well, ozone can be used in several different ways, but the way that you might be referring to there is intravenous ozone therapy.
Yeah.
And that's something that has systemic effects. So it has those anti-inflammatory, immunomodulating, tissue healing. It also, like, as Ed McCabe would say, like, you're flooding your body with oxygen. So it's one of the very few ways that we can actually get more oxygen into our tissues. They've done a lot of studies showing that when you do intravenous ozone, it increases your tissue levels of oxygen. Why do we care about that? Well, we have these little structures in our cells called mitochondria. They make all of the energy for our cells, and they need oxygen. The reason that we all just plug our nose and close our mouth right now, and after 2 minutes we won't be having any more conversations, is because we need to keep that steady flood of oxygen getting into our tissues so our cells can make maximal amounts of energy. So especially in a concussion situation where ultimately we want to try to rehabilitate those poor mitochondria and support the tissue as much as we can and reduce inflammation, the intravenous ozone can be a helpful adjunct to that. And I could talk all day about it. I teach a
Yeah,
two-day
no, no, no.
training course about it, so clearly I could talk for 2 days
Because the
about it.
reason
But
I was talking about that is because, like in a concussion, you have what's called glial priming, where the brain is in constant, an inflammatory state, right?
mhm,
So outside the joint space,
mhm.
what systemic conditions do you typically see? You do intravenously, right?
Mhm.
So
We do.
what other systemic conditions would you see, just to name some off so that some of our listeners are aware?
Sure. Yeah. So, like chronic fatigue syndrome, fibromyalgia, any autoimmune condition. So, like RA, psoriasis, MS, ankylosing spondylitis, like any of those, it would be
Wow.
indicated because it has this immunomodulating effect, which is really quite valuable. Folks who are just wanting to have enhanced performance. So there's some patients we treat that are biohackers, as they like to call themselves. So just trying to have better performance at the gym or healing faster. And actually, on the topic of healing, I've recommended IV ozone therapy pre and post surgery to a lot of patients, and just it's
Great
all kind of
idea.
anecdotal, but oftentimes it's very rare that someone has done their pre and post ozone and they don't have they're like, oh yeah, like it's taken forever to recover from this. Like it seems I'm convinced from my
To me,
clinical
it's why
experience
wouldn't
it's
you,
helping.
right? Like it just makes total sense.
Hmm. Yep.
Just going to go to this conversation because we just were touching on concussion there for a moment. I was just wondering and curious about, you know, aerobic exercise and concussions. Obviously, the research is coming back and saying that it's great to do a little bit of aerobic exercise following a concussion. Now, if somebody were to have ozone therapy as well as exercise, would that be too much too soon? Or would you normally say, let's go through this trial of ozone before we start doing anything too physical?
Yeah, I think, I mean, they've done some really interesting studies looking at adverse effects from ozone therapy, and bearing in mind that they have like very broad inclusion criteria. So like folks that are really down and out versus folks who are trying to be as superhumanly healthy kind of thing. And like the side effect profile of IV ozone is very, very, very low when it's done in a safe way. There's certain ways of doing it intravenously that are maybe not as safe as others. So we of course only use the very safest way in our clinic, but in other places sometimes they don't. But when it's used in the safest way possible, like the side effect profile is negligible. So I think extrapolating from that, I don't think you can overdo it with ozone. I don't think you can over oxygenate somebody's system. I think that in a case where someone was just not quite ready to start doing more aerobic exercise, then the IV ozone would be a great gateway oxygen enhancing tool to use, because you just really just get to sit there as the IV is being done passively, no exertion required. But yeah, I think it could be complementary probably at any stage of concussion recovery.
Excellent. Thank
That
you.
is that is awesome. So price range on ozone, if you're doing injection, obviously if it's already PRP,
Hmm.
it's free, but or free. It's part of the thing because the needle's
Hmm.
already in there.
Hmm.
Injection ozone only versus intravenous ozone price range.
Yeah, so if we're doing injection ozone only, it's so just my time, and because there's no blood draw or prep or anything like that,
Right.
so no resident getting involved there, and so it's just my time. So if it's just a like standard injection visit, which would be done within about half an hour or so, that's $90. There's no tax on any naturopathic services because they're tax
Yep.
exempt, and so it's $90, and then the cost of the ozone is $25, and there's no tax on that either. So that's just like injection only, ozone only going into the injections, and then intravenous ozone, the cost for either my resident or one of my other colleagues who runs the IV room for me at my clinic. That's $85, and then the cost of materials for the ozone is $40. And we kind of split it up like that because if people have insurance, then they'll typically cover the IV kind of like
Yeah.
service fee component, but not the materials. Because as I like to say, the insurance companies expect us to heal our patients with our words alone. I mean, for you folks, you can use your hands and tools and all that, and we can, you know, do some things with our hands too. But by and large, you can't just IV words into somebody. It doesn't really work that way, unfortunately.
Yeah. No, I think I'm gonna become a biohacker and make an appointment every
Should.
month just
You should.
to
Oh, you're welcome
regenerate
to.
my brain. That's
Sounds good.
unreal. That's really cool.
Mhm.
So guys, obviously, if I'm learning, I know you guys are learning. So if you've learned at least one thing tonight, please give us a few thumbs up and hearts. And please, right now, if you haven't done so, share this episode. This is how we pay for Dr. Rade's time right now for this word to come out. He's doing this out of the goodness of his own heart and, you know, spending time with us, and which I think is great. And but we need to get this information out there because there's definitely people going down a slippery slope with the things that they're trying and not getting results, and the life quality of life that they're not getting, and going through life in pain, as we know, is just not fun. And everybody deserves to live quality of life. Um, what else are we going to talk about tonight,
I wanted
Ben?
to sort of just ask a little bit because, again, you know, just like so many Nova Scotians, I didn't grow up with complementary healthcare providers in my community. And so there are a lot of people on this webinar here today who have never seen a naturopath before. Um, and so you were sort of alluding to the large scope of practice that you have. And, you know, clearly injections are a large part of the practice, but it's not the only thing that you do. Could you perhaps give just in a nutshell um, the philosophy of your practice and what your aim is there?
Sure. Yeah. So, I mean, there's certain core naturopathic principles that all naturopathic students learn in naturopathic school, and hopefully we all strive to, you know, practice them in practice once we're out in the world. So, some of those principles include working with what they refer to as the healing power of nature. So, kind of looking at the body as being this very wise organism that is geared at self-preservation, self-healing, and just given the right circumstances, the body should be nice and healthy. Um, and so that's something that, you know, when I'm approaching a patient, like approaching a case, I'm thinking to myself, not so much like, okay, what do I like? What's the natural thing that I can use to band-aid this or that? And don't get me wrong, like band-aids are great. Like I get a cut, I want a band-aid. Person's in pain, like yeah, like use the Tylenol, like use the ibuprofen, like whatever, or use the curcumin or whatever it is to help, you know, reduce the symptoms in the moment, absolutely. But ultimately looking to see like what are the obstacles to this person's physiology not working well. Do they have chronic infections? Do they have issues with heavy metals? Are their detox pathways all gunked up? Are they putting a lot of, you know, inappropriate foods in their system and that's bogging them down? So kind of looking at how can we create a set of circumstances so the body can be as healthy and thrive as much as possible. Another principle that we follow is that of, you know, as they say, like doctor is teacher. So we're, you know, and to my understanding, and my Latin's a little rusty, but I believe the word doctor means teacher. And so we're supposed to be teaching our patients, and obviously you folks do, and I try to do that as well. So we want to teach our patients, you know, like what's happening with your body, why are you taking these things, how long should you be taking them for, what can you do to augment your healing more. So trying to make it really a team effort as opposed to like, you know, just listen to me and then you'll be fine. It's like, well, no, I want you to be engaged in that process. And then another principle of naturopathic medicine is just treating the whole person. So we're not just looking, like, one of the things that patients complain to me about on a semi-regular basis, where again, I treat a lot of complicated cases. And so as such, the um, you know, patients will come in saying like, I've seen so many different doctors, so many different specialists, and I'm so frustrated because like I have digestive issues, I have bladder issues, I have lung issues, I have fatigue, this and that, and like I'm seeing 5 different specialists, and like I think they're all interconnected, and I'm saying like, yeah, of course they are. Like it's one body, like
Yeah.
it's all like literally interconnected. And so as naturopathic doctors, one of our core principles is looking at everything together, and not just on a physical level, but also bearing in mind, you know, a person's mental and emotional state of health as well. So, you know, aside from the injections and the various IV therapies that we do, we work with a lot of herbs and, you know, talk to patients about nutrition and, of course, like different supplements like vitamins, minerals, amino acids, antioxidants, all the fun, you know, health food store stuff that's out there. We do, like, we're trained in Chinese medicine, so we do acupuncture. So there's, and then there's a lot of other branches of training that some folks will do. Like some of my colleagues go and wind up doing a lot of different physical medicine and body work. Some of them do a lot of counseling. There's it's just like how there's specialists in, say, conventional medicine. There's also kind of like different special focus areas for naturopathic doctors as well. So lots of variety out there.
Great. Thank you so much. And
Good
that just,
answer.
you
Yeah.
know, definitely gives the patient a better idea, you know, especially new patients coming to your practice that might be here listening tonight. So thank you very much. Similar in the chiropractic profession, we have those, you know, these little diplomats, right? And those sort of things. And we all strive to be, you know, either one or, you know, that or this, or say I'm more of this or I'm more of that. But the truth is that, you know, we touch on a little bit of everything. So I just love how you brought that up. That's so great. Thank you.
Brian, we had a question, and I think I know how to answer this, but so some of your treatments are covered under insurance plans. So in the case of like PRP, I'm assuming your time is billable, but the actual PRP may not be. Is that?
That's right. Yeah.
Yeah.
Yeah. So my time and my residents' time, they're generally that will be covered under extended healthcare if a person has like Blue Cross or Great West Life or whatever it is. And then, but the companies will fairly rarely cover the cost of the PRP itself.
Right.
Sometimes they do, like it's worth asking. And then to be perfectly frank, some patients just kind of submit the receipt and they're like, everything got covered. And I'm like, okay, we just won't ask questions. And that sounds great. Anyways, yeah. We don't do any direct billing or anything like that. So we don't get involved with that. These are the anecdotes that patients tell me.
This may be news to you guys tonight, but we are going to have Dr. Rade again twice more. We've agreed upon a time next month and a time and day for the month after. So we're going to have him in the month of August and the month of September. If you like that, give us a thumbs up. And I think we're going to address some of those questions in later topics. Question: in Raynaud's disease, can treatments be used to help increase blood flow or healing from cuts to the extremities?
Yes is the short answer, I've seen it improve. Actually, interestingly enough, if patients are able to access it, IV ozone therapy I've seen be really helpful. I have one patient who had really bad Raynaud's and had to work outside during the winter, and was doing work where I don't even know how this is feasible or legal or reasonable in any way, but basically like it was really like fine dexterity work that needed to be done. So the person couldn't wear gloves or anything. So I had like bare hands outside in the middle of winter with Raynaud's, which is like just torture in some places, I'm sure. That's just awful for anybody, let alone if you have Raynaud's and so much more sensitive to the cold. And so IV ozone is really helpful. But then we actually would do ozone injections, where there's sort of a method where we can actually get ozone to go like into the entire hand basically with just one injection site. So it's not like I was torturing the poor person with like 30 injections like both hands. But anyways, we injected a bunch of ozone, and like for like days afterwards be like, yeah, like no problem working outside, like, you know, Raynaud's was just doing great. So anyways, ozone can be applicable in that case. Over and above that, looking at things that would impact a person's antioxidant levels. So whenever there's any type of like a vasculitis type issue, it can oftentimes be related to some antioxidant deficiency. Looking at inflammatory factors, so like the anti-inflammatory diet that was asked about earlier, that can sometimes be very helpful for Raynaud's. And for promoting tissue healing, it's really about asking the question like, why aren't those mitochondria, those little energy producing units in the cells, why aren't they cranking out enough energy? Why is it that the healing time is too slow? And is that because the mitochondria don't have some of the nutrients they need? Is that because they've got too many toxins in them, like heavy metals or mold toxins or viral overgrowth or different things like that? Or, you know, or is there not enough oxygen delivery because the person's not active enough? Which again is how ozone can sometimes help in that case too. So there's a number of different factors, but I have seen Raynaud's respond well to treatment before.
Right. No, that's great. We had another question about diet to reduce inflammation. I believe we agreed that that was going to be the gut part was going to be our second lecture, I think. So second or third, we don't divulge too much. We're going to do promotion around that, but definitely that's going to be talked about. We just don't have time tonight, Shelley, but that is going to be on our one of our future talks. I see no more questions. So what we're going to do is we're just going to end off here. Doc, thank you so much. Like I learned a lot tonight. And I know, like I said, I know if I learned, I know everybody learned. I have a fond appreciation for Uber learners like you and everything that you've accomplished. And to be able to have you in our backyard, so to speak, is an amazing thing. I commend you for, being in the trenches every day and putting your heart on your sleeve and working with these people. I thank you for, what you've done for our family already. Thank you for that. And if you're watching this live on YouTube, make sure you subscribe. You can watch the other episodes. Every month, we have a brilliant person, and this month is no different with Dr. Brian Rade. We're going to have him for the next 2 months as well. And right now, if you haven't done so, please, for Dr. Rade's, just share this episode. You never know how far reaching this episode may go for somebody who is just dying to hear this information right now, because it's affecting their life to the point where it's affecting their family, their mental health, whatever, right? If you know somebody who is in pain and you've been around those people, it changes their personality, and they know that, right? So to be able to have somebody like Dr. Brian Rade here in Bedford, Nova Scotia, it's pretty cool. So thank you from the bottom of my heart. Ben, anything you want to say?
Thank you so much for doing this. Like I mentioned and alluded to prior in the beginning of the conversation, growing up in a community where we didn't have a naturopath, not being educated early on in life on how naturopathy could affect and chiropractic could have an effect on my life. And for you to come on this program and come on to talk with us tonight and speak to people who maybe not have heard from a naturopath before is huge. So you're opening your eyes up to more people than you think, being the great doctor that you are. So thank you so much.
Thanks so much, guys. Appreciate it.
One thing, and I'm going to end with this. I'm going to put you on the spot, Dr. Rade.
Oh boy.
If an alien came on this planet and you had one piece of advice on how he could stay healthy, and one thing that maybe you have done for yourself that, change your life, one piece of advice, whether it's diet, avoid this, do this, what would be the one thing that our listeners could go home with as a golden nugget and say, let me research that a little bit more? He said that that's the one thing that he would do. What would that be?
Oh my goodness. Yeah, that is a putting on the spot kind of question.
I know. It's a tough question.
Well, it is a tough question. And the answer is like, do I say something really cool that you've never heard of before? Because that's exciting. And then it's like,
you're already cool enough, Brian.
Oh, thank you. Or do I give you the answer that's like the really genuine, true answer? Even though it's a little. You do have to drink water. That is pretty important. The answer I'm going to give, it's going to be a little boring, but it's at least an honest answer. I think that working with an optimal diet for the person in question is probably the most impactful thing that one can do. Probably closely followed by like being physically active. I think that if we were all doing that, we'd have like 1% of all the health maladies that we have. But I do think that it's important to work with an optimal diet. So maybe the thing that I will add to just maybe flower that up a little bit more, make it a little bit more enticing, is that for some patients, like using a paleo diet is optimal. Some patients need to take it a little further and do an autoimmune paleo diet. I have some patients who have been doing really, really well with something called a carnivore diet, where you eat nothing but meat, believe it or not. I'm actually rounding the bend on my 5th month doing this insane diet that I thought was idiotic when I first heard about it, but I actually feel markedly healthier. I was feeling really good before. I feel like probably 10% healthier having been doing this diet myself. So there's it's really about like, but then I've had a number of patients who've heard me squawking about the carnivore diet. They've tried it and they haven't felt good. So like, it's not a one size fits all for people. Right. So I think trying to find the optimal diet based on your health needs and goals and whatnot, I think is probably one of the most impactful things that can be done.
And that's a great segue into our future talk. We're going to talk a lot more about that, including the question we had about Crohn's. We're going to be talking about that as well and kind of incorporate it with that whole discussion. So this is it, guys. Thank you so much for everybody that was live here tonight. I appreciate your loyalty to Hump Day Conversation, and to everyone tonight. I hope you have learned something. I know I have. And we look forward to sharing this episode. If you haven't done so, do it right now. And we will chat next Wednesday, 9 o'clock, Humday Conversation, episode number
34.
34. And we will connect, and you'll know when Dr. Brian Rade is going to be on next month. There would be plenty of notice. Whether or not we do a webinar again versus just a regular meeting live on Facebook, we'll see. And we'll get some feedback on how you guys liked it tonight. And yeah, so look tomorrow morning. It'll be posted. I'll give you the link, Brian, so you can feel free to share with your social surrounding and on your website as well. And that's it. Thank you so much, Dr. Rade. Really appreciate it. And we will see you next week, 9 o'clock, Humday Conversation. Good night to all.
What's up, guys?
Listen, if you like this episode, you'll probably like the other ones. Chances are pretty good. So here's what you need to do. You need to like us and follow us on Facebook. Following means you get notified when these two guys
are live.
Next, family, friends. You need to share these episodes because you never know. You might help them because they need this information as well.
And guys, if you ever miss an episode, make sure you subscribe to us on YouTube. That way you can watch the episode over and over and over again.
Guys, we love you and appreciate you.
Take care.